Welcome back for another edition of the Top 100 Drugs. We are going to go through 31 through 40. Let's get started. Up first, we have Crestor. Crestor is the name brand for rosuvastatin and comes in all those strengths. I found this nice graphic for you. Another statin, so you know what that means. Look up at your grid. Atorvastatin, pravastatin, it's all the same. It's all for hyperlipidemia. Avoid grapefruit juice. The difference with this one, unlike pravastatin, this one can be taken any time of the day. You have to also, like all the statins, monitor the liver enzymes. And all the statins have the potential for muscle pain. And next is Coreg, the brand name for carvedilol. It's used for CHF, congestive heart failure, and hypertension. And if it's carvedilol, plain or immediate release, it is going to be dosed twice a day. BID. BID. B like a bicycle, 2 wheels. Control release is the Coreg CR. Control release or long acting only is dosed once a day. And very important, it cannot and should not be stopped abruptly. It is contraindicated, which means a person cannot have it if a person has a bronchospastic condition. Okay, so that would be a bronchial asthma, where their lungs are really involved in the asthma. The reason for that is because it's a non-selective beta blocker. And you'll if you want to be ambitious and look into this a little bit more, you don't have to for the purposes of this, but a lot of people will remember beta blockers. There's beta 1 and beta 2 receptors. The beta 2 receptors are on our lungs. You have 2 lungs, so beta 2 is lung. Beta 1 is the heart. This is not very selective, so it can affect, in an asthmatic, it could be a very bad problem. For other folks, probably not an issue at all, but if a person has asthma and their asthma worsens and they are on Coreg, that was a mistake. They shouldn't have been put on Coreg. So it's an alpha beta blocker and ends in not all like the beta blockers. It ends in illol, and I don't know of any other alpha beta blockers, honestly. I think this may be the only one. We still use it quite a bit. So let's move on to prednisone. Now, nobody's making the brand anymore, but I want to give you the brand name because it may still be referred to it this way. Deltazone. Okay, this triangle is the Greek letter D, delta. Enzensone. It's a corticosteroid, like the Flonase and the Flovent, but this is a pill. And like I promised, we would talk about some of the side effects. We're going to get into that in a second. It's anti-inflammatory, and that's immunosuppression, causes immunosuppression, which is very helpful if someone has a brand new kidney or had some other sort of organ transplant. They might be on this for the rest of their life. And it should be taken with food. Side effects, there are many. It's very upsetting to the stomach. It can cause stomach ulcers, especially when a person combines it with something else that causes stomach irritation, like Motrin. So they cannot take it with ibuprofen or aspirin. Very bad. Appetite. It can increase the appetite. So it's not going to happen if you're taking a 5-day course for poison ivy. You know, you're inflamed all over, and your doctor gives you a short course of prednisone. But if you're on it like 2 weeks, you're going to get hungry and moody, maybe aggressive, short-tempered. And if you're on it longer than 14 days or on a very high dose, you have to taper off. It's really rough on the adrenal glands if you're not tapering off. So the doctors will always write a tapering schedule. Next up, we have the ibuprofen. Now, ibuprofen, I still have this bottle hanging around here. Comes in pills and comes in liquid for children. And I have the suffix here, profen. There are some other profens. Not too many though. It's used for pain, fever, and inflammation. And it's an NSAID, N-S as in Sam, A-I-D. It's a non-steroidal anti-inflammatory drug. Now, we don't call steroids like the prednisone, we don't call it a SAID, steroidal anti-inflammatory drug. Don't need to. But this works a lot like prednisone, and it's because it's anti-inflammatory. So we call it an NSAID. I guess I didn't put that acronym down here, but you're going to see the NSAID a lot. And you may find patients who say they're allergic to NSAIDs. That would mean they're allergic to this and others in the NSAID class. A lot of times they're not, they just can't take them. So they put it in as an allergy. For example, a bariatric patient, a patient who has had bariatric surgery. They've had their stomach shrunk by surgery to a little stomach because they needed to lose 400 pounds. And that's a bariatric patient. They can never have this again. So they're going to put it in their chart as being allergic to this medication. It's not a true allergy, but on the other hand, we don't want to ever accidentally give this to them. So again, it's available over the counter and by prescription. I think I said that in one of my earlier videos. But over the counter is only 200 milligrams per pill. By prescription, it comes in 400, 600, and 800 milligrams in one pill. And it comes in liquid. The liquid only comes one way. Oh, look, I have a chewable up on the screen here. It does last for 8 hours. And you'll also see, this is not in the same drug class as Tylenol, so you'll see a patient, especially children with high fever, being prescribed, even though they can buy it over the counter. Doctors and prescribers like to write prescriptions so the patient has the directions that the doctor wants. If their fever is over 103, give the Motrin and Tylenol and stagger them. There's obviously this ulcer risk. And the higher the dose, the worse it's going to be on the stomach. So we tell patients, take it with food. Now, you might be able to get away with taking an ibuprofen over the counter without food, like one pill. But when you start taking 800 milligrams and you do that for 3 days straight because you sprained your ankle, you might end up with some severe stomach discomfort if you do not take it with food. And by the way, no alcohol either. Next up, fluoxetine, also known as Prozac. So go up to sertraline. You can copy most of that right to here, okay? SSRI, selective serotonin reuptake inhibitor. It's used as an antidepressant and many other things like post-traumatic stress disorder, social anxiety disorder. This one you'll see it's kind of exclusively used for premenstrual dysphoric disorder, or PMDD. Has the box warning of suicidal risk in teens and young adults. And it also takes a few weeks for it to start working, and even maybe a few more weeks for full effect. Up next, we have Coumadin, brand name for warfarin, and it comes in lots of strengths. It is an anticoagulant, and that means it's a blood thinner. It's used to prevent a stroke. It's actually used for preventing a lot of things, especially if a patient has AFib, which is their heart is beating super, super, super fast. They've had a deep vein thrombosis, which is DVT, and this will prevent that, which is clots in the leg. And if they've had a clot in their leg, we don't want another one, because then it could travel somewhere into their heart or their brain, end up with a stroke or a myocardial infarction. So if they've had a clot, they may end up on warfarin to prevent that from happening again. Pulmonary embolism is when the lung the clot gets trapped in their lung. So we don't want that happening again. And they could also be on warfarin. So you'll see there's a lot of reasons to keep the blood thinner. And also mechanical heart valves. Okay. Also after surgery, if a patient's going to be laying in bed a really long time, like maybe a month, say they had some, I don't know, they may end up on warfarin. If not warfarin, they may end up on another blood thinner. Warfarin has been around a really long time, actually comes from rat poison, and causes rats to hemorrhage and die. It's really brutal. So, yeah. Strict monitoring of the INR, and that is a lab that will tell the doctor how well or not well the blood thinning is occurring. And avoid vitamin K, because vitamin K actually causes clotting. Vitamin K rich foods, or vitamins that happen to have vitamin K in it, not to be confused with potassium, which is abbreviated with a K. Very easy to get them confused. But vitamin K, which is a fat soluble vitamin, vitamin K rich foods would be like green leafy vegetables. They have to stay off of it because it will really mess with their lab values. All right, so we have a box warning of a fatal bleeding risk, of course. So the reason I mentioned that K is fat soluble is because we're going to learn later that fat soluble vitamins store in the fat, so you can actually overdose on them. So if the person loves to eat spinach every single day, they're going to save, their body's going to store all that vitamin K, and it really messes with their labs, which actually messes with their warfarin, right? And then they end up maybe getting a clot. Okay, so I want to look at something. I want to look at warfarin in a clinic setting for just a moment. All right, so let me get to that screen. The reason I want to do this is because there are clinics built around warfarin, and so that could be where you end up working. So you need to know what the warfarin clinic is. This just happens to be from the University of Washington Medical School, I guess. They have a hospital there, and they have an anti-coag clinic. So I'm not going to go through this. If you're ambitious, please look this up, but I'm not going to go through it line by line. I want to try to give you an overview so you can understand, if you did happen to apply to work in an anti-coag clinic, what kinds of things they do. They pretty much are just monitoring the patient's labs and adjusting the dose. Okay, so we're going to go down here, the dosing. I'm just going to read a little bit. Most patients are going to start at 5 milligrams a day, and they're going to adjust according to the INR results. All right, so they have a little grid here. If they're over 75 and have clinical congestive heart failure, they're going to be on that dose. And these factors can increase their sensitivity to warfarin, actually. So they might need, let me read. So this here means they're going to, anything in this grid is a sensitive patient. So these patients are going to start at 1 or 2.5 milligrams a day, and they're going to adjust. So this is a nomogram. All right. So the first day they start, they don't have an INR lab done, but they're going to have their lab done like every day, and they're usually in the hospital when they're getting adjusted. Okay. So first of all, most people are going to be in, let's see, 1 or 2 of these columns. And again, I don't want to spend a lot of time on it. Let's just say the patient is told to start at the 5 milligram. Okay. So day 2, if their INR comes back at 1.5, they're going to get another 5 milligram pill. If I'm trying to see what the target is. I think we'll see it a little further down. If their INR comes back in this range, okay, the next day they're going to get a 2.5 milligram. Now the next day, if their INR comes back again at that, the doctor's going to go with either 2.5 or 5 milligrams. So you can see if their INR comes back at 1.5 again, the doctor might keep going up with it. So the maintenance in this case, we're going to say their goal is for their lab to come back with an INR of between 2 and 3. All right. If their INR doesn't come back, then this is what the doctor's going to do. If this is their goal, this is what they're going to do. So I hope I'm not confusing you, but I just want you to understand that you could go, and I think if you spend a little time with this and read it, you would understand this. It's really not too hard to understand the nomogram. The goal is to have this lab always read right here between 2 and 3, although a different patient might have this goal. Okay? And so you follow these basically like a flow chart, okay? And this tells you how often they're going to be monitored, okay? So it's, oh goodness, there's even more. These are the drug interactions. So if you're interested in going to this, this is the website, okay? Take a look at it. I think it's pretty cool. And again, there's anti-coag clinics all over the place. You may end up working in one day, and you'll have an idea of what's going on. All right, let's move on. We have the next one, also a blood thinner, but a little different. Clopidogrel is the generic name to Plavix. It's a platelet inhibitor. It's used to prevent stroke or a myocardial infarction, which is MI, or it's used after a patient has had a stent put in. It is a prodrug, and that a prodrug means your body's going to convert it to the active form. And so what's really interesting about this is, okay, so this is some deep pharmacology here. It's cytochrome P 450. Pretty much all the drug interactions that we see as pharmacists, there's like 100 of them. They all have different little numbers and letters after it. What I want you to know is if you see CY and a P, and that stands for cytochrome P. Once you see that much, you know, okay, there's a potential for a drug interaction. That's the most you need to know. But anyway, so some people are lacking in that particular enzyme. It's cytochrome P C19. I don't have these memorized. I let the software help me with this. They can't convert the prodrug clopidogrel to its active form, and so basically the doctor's going to order a lab to find out if Plavix is the right drug for them. So that's sort of important. It's very interesting. Next, we have Zestoretic. This will be the easiest one. 2 drugs we've already done, lisinopril and hydrochlorothiazide. One of the brand names is Zestoretic. So I'm not going to tell you anything about this. Just look up in your grid and you will know it's for blood pressure, and you'll know you have a diuretic in this combination pill, okay? It's an ACE inhibitor with a diuretic. Next up, we have Protonix, and I thought I'd show you a vial of medication instead of the pill form. This is kind of interesting. The vial and the pill form are the same strength. That doesn't happen a lot. So Protonix is the brand name for pantoprazole. And it's a prazole, not a fungal, but a proton pump inhibitor. Reduces stomach acid. And like the other one that we did, the other proton pump inhibitor, going to take this 30 minutes before you eat. Or bedtime is a great time too, as long as you haven't eaten for 2 hours. That's about how long it takes for your stomach to become empty again. And I think I might have mentioned this before, but if you're removing the acid from your stomach, it will make it a lot harder to absorb nutrients and vitamins, especially minerals. All right, I've got a new prescription for you to read. Let's read this one. Pause it, read it yourself. Welcome back. We have Protonix, 40 milligrams, 1 PO, 30 minutes, ACQ day. Number 30. All right, so What we have here is Protonix, 40 milligrams. Dispense 30 pills. We always say the quantity when we're calling in prescriptions. We always say the quantity right after the drug name and dose. Take 1 tablet by mouth, 30 minutes. That's what that little thing means. AC is anti-comida. That's before food. I think of ante as like you're playing poker. Ante up. Right before you start the game, you got to put your money in. So that's why we have A, and comida is food in some other languages like Spanish. So AC means before food. 30 minutes before food every day. Refill 11. Doesn't say that. But I wrote it. Oh, we'll have to call and clarify that. All right, up next, we have our final drug in the set, Ambien. One of my most favorite drugs. I'll tell you why in a moment. That is the brand name for zolpidem. Oh, look at this. We got the C4 here. It's Schedule 4, right? It's controlled substance. It's used for insomnia. Someone who has a difficult time sleeping. And Schedule 4 has a boxed warning. So before I tell you the boxed warning, let me tell you my quick little story because you're just going to enjoy this. I was actually prescribed this. And the reason I was prescribed it is because when I was working in the hospital, I needed to go to bed at 6 o'clock at night. My doctor and I agreed, this will help you fall asleep. I had to go to bed at 6 because I had to go to work at 3 a.m. We worked these kind of overnight shifts at the hospital I was working at. So I would take the pill and go to bed, close the curtains, and I would fall asleep. So here's the boxed warning. Sleepwalking or sleep driving. People have gotten killed from this medication. It's really scary. So the patient really needs to know, take the pill, go to bed. So what I did was I took the pill and didn't go to bed. Actually, I'm not really sure. I can't remember because it causes memory loss. I have a vague memory of being awake and answering the telephone. And I remembered this months later because what happened was one day my friend showed up at the door. My husband wasn't home from work yet. And my doorbell rings and it was around dinner time. And I opened the door and I'm like, hey, what you guys doing here? And they're holding food. They brought like 2 big things of food and I said, come on in. And they came in. It took me a while. And my friend Donna, she said, did you forget that we were coming over? And I said, yeah, I guess I forgot to put it on the calendar. So anyhow, we had a big dinner date and I wasn't prepared, didn't even remember. It started coming back to me and then I told them what happened. I said, I answered the phone and we agreed to have dinner together and we planned it all out. I had no memory of it. So, wasn't deadly, but it does cause memory loss. So about 30 minutes after taking it, you're not going to remember anything. So the patient needs to go to bed, stay in bed. This medication came out as a temporary solution for insomnia. It was never meant for people to be on for years and years. And I wasn't. I only use it 3 times a week. And we do have patients on it now continually. And it really is a concern. It's a big concern. So that's all I have right now. We're up to number 40. See you in the next movie.